Chapter 16. Basics of First Aid. If we hurt ourselves or others by chance, we call it an accident. Accidents can occur at any place and at any time. They may result in injury and may even cause damage to life and property. First aid is the immediate help that is given in an emergency situation to the individual. First aid helps in minimizing the injury, and in worst cases can help in saving the life of the individual. Aims of first aid. First aid is the first assistance or support given to a casualty or a sick person. For any injury or sudden illness before the arrival of an ambulance by a qualified paramedical or medical person, or before arriving a facility that can provide professional medical care. First aid cuts and wounds. An injury is caused when a knife or a sharp object cuts or breaks the skin, or when the skin gets ruptured. Germs can enter the body through cuts and wounds. Cut in the hand. Wash small cuts with plenty of water. Apply antiseptic cream on the wound. First aid burns. Burns are caused when boiling water falls on the skin, or when we touch a hot object. Minor burns cause the skin to turn red with a painful tingling sensation in the affected area. Burn in the leg. Do the following in case of accidental burns. Keep the burnt area under running cold water for some time. Ice can also be applied. Apply an antiseptic cream or paste of baking soda, sodium bicarbonate, on the burn. Cover the person with a blanket if a person's clothes catch fire. This would cut off the air supply, which is essential for fire to remain ignited. Take the victim to a nearby doctor immediately. If the victim's clothes catch fire, wrap him or her tightly in a blanket. This will extinguish fire at once. In case of a major fire, call fire brigade on 101. First aid fractures. A break or crack in a bone is called a fracture. A fractured bone needs proper bandage and special care to prevent further injuries. Arm bone fracture. Do the following in case of a fracture. Ensure that do not move fractured part. In case of an arm bone fracture, use a sling to give it a firm support. In case of a leg bone fracture, tie a splint tightly to give support to the broken bone. The splint should be long enough to extend well below and above the fracture. Take the victim to a doctor immediately. First aid animal bites. The bites of some animals like dogs, cats and monkeys can be very serious. They may cause a deadly disease called rabies. Doctor giving treatment. In case of an animal bite or sting, do the following. Wash the wound thoroughly with clean running water to remove the germs. Apply an antiseptic cream or lotion to prevent infection. Tie a bandage over the wound and take the victim to a doctor immediately. Some snakes are poisonous. Snake bite can be very dangerous. When a snake bites, it injects its poison, venom, into the victim's blood. The poison in blood quickly goes to the heart and brain. It may stop the working of the heart and brain, and the victim may ultimately die. Wash the wound. In case of a snake bite, do the following. Put a mark over the bite and tie a bandage tightly above the cut to stop the poisonous blood to reach the heart and brain. Wash the wound with potassium permanganate. Keep the person calm and at rest, asking him or her to remain as still as possible to avoid venom from spreading quickly to other body parts. Take the victim to a doctor immediately for further treatment. First aid drowning. Swimming, boating and water sports may sometimes result in drowning. Lie down and press the back. To treat a drowned person, do the following. Make the victim lie down on his or her stomach on the ground. Press his or her back and stomach to remove excess water through mouth. Try to give him or her artificial respiration. Take the victim to a doctor for further treatment. First aid poisoning. Children may, sometimes, swallow hazardous things, such as paint, detergent, medicine, naphthalene balls, etc. First aid for poisoning. In such a case, do the following. Give the victim some milk and water, and induce vomiting. Take the victim immediately to a doctor. First aid electric shock. An electric shock can be very dangerous. Electric shock precaution. In case of an electric shock, do the following. Turn off the main switch or MCB. Never touch the victim before turning off the main switch. Ask the victim to lie down calmly to relieve shock. Call for a doctor immediately. First aid nose bleeding. In case of nose bleeding, pinch the soft part of nose and hold it for a few minutes till the bleeding stops. Make the victim lean forward and breathe through mouth. Put a cold and wet towel on the face and at the back of the neck. Nose bleeding. Create a home first aid kit. We all should keep first aid box at home. It should contain the following items. Antiseptic lotion like Savlon or Dettol, antiseptic tape, cotton pads, crepe bandage, sterilized gauze, methyl spirit, band-aids, scissors, balms, etc.